Have you ever trusted a medication so deeply only to discover it might be quietly turning your body against you? Millions of Americans take atorvastatin every single day to protect their hearts. They believe it's a life-saving prescription, something their doctor gave them to keep them healthy. But what if that same pill could also be stealing your energy, damaging your muscles, clouding your memory, or even pushing you toward kidney failure without a single warning sign? Here's the truth no one talks about. Atorvastatin belongs to a group of medications called statins. These drugs are known for lowering cholesterol, but beneath that promise lies a growing body of research revealing something far more dangerous. From severe muscle breakdown to cognitive issues that mimic dementia, the side effects are not only real but disturbingly common. What makes this even more frightening is that many of these symptoms are mistaken for normal aging: fatigue, forgetfulness, joint pain, trouble sleeping. For many people over 60, these are dismissed as just getting older. But sometimes they are your body's desperate cry for help. Doctors rarely have time to walk you through the full picture. That's where this video comes in. This is not about fear. It's about facts, awareness, and power. Over the next few minutes, we'll reveal 15 dangerous side effects of atorvastatin, backed by medical studies, real patient cases, and expert insights. We'll show you how these effects show up, how they harm your health, and most importantly, what you can do about them before it's too late. This could be the video that helps you finally connect the dots. If you or someone you love has ever felt drained, foggy, or not quite themselves while on this medication, do not look away. Because one of these 15 side effects could be happening inside your body right now without you even realizing it. And once you understand what to watch for, you'll never see this medication the same way again. Number 1. Muscle pain. It always starts quietly. A little soreness in your legs, maybe stiffness in your hips. You tell yourself it's just aging or a long walk. But what if that pain never leaves? What if it gets worse every week? Muscle pain is the #1 side effect of atorvastatin. In clinical trials, about 10% of patients report it, but in real-world settings, up to 20% suffer from daily aches, cramps, and fatigue that never go away. The reason atorvastatin disrupts calcium inside muscle cells, causing inflammation and tissue breakdown. The damage builds over time. Your legs feel heavy, your back starts to ache, and suddenly the joy of movement becomes a burden. One patient said it felt like her muscles were shrinking from the inside out. She stopped going on walks with her grandkids. Even getting out of bed became hard. These stories are more common than you think. So what can you do? Ask your doctor about coenzyme Q10, known to support muscle energy. Request a lower dose, or try a different statin with fewer muscle-related effects. But just knowing this isn't enough, because the next side effect doesn't hurt at all until your liver starts failing silently. Number 2, elevated liver enzymes. While muscle pain might be loud, liver damage is completely silent. You won't feel it in your chest or legs, but inside your body, something dangerous could be building every single day. Atorvastatin is known to raise liver enzymes, a sign that your liver is struggling. For most people, this damage happens quietly and shows up only in blood tests. Studies reveal that up to 0.7% of users experience enzyme levels 3 times above normal. It sounds rare, but here's the problem. These levels often rise within the first 3 months and carry no symptoms at all. One man discovered it by accident during a routine checkup. His doctor caught the spike early and changed his dose. He said, "I had no idea my liver was stressed. I felt completely fine." That's the scary part. The danger builds without warning. What can you do? Always ask for liver function tests 6 to 12 weeks after starting atorvastatin. Avoid alcohol during this period, and report signs like fatigue or dark urine to your doctor immediately. But just knowing this isn't enough, because what comes next can move fast and leave your kidneys permanently scarred. Number 3, rhabdomyolysis. What if your muscles didn't just ache but actually began to break down? This is not soreness. This is not aging. This is a medical emergency that can shut down your kidneys in a matter of days. Rhabdomyolysis is the most severe muscle-related complication linked to atorvastatin. It happens when muscle fibers start to dissolve, releasing a toxic protein called myoglobin into your bloodstream. This overload can quickly damage the kidneys and lead to permanent failure. And it often begins with the same kind of pain people ignore for weeks. In one case, a healthy man in his 50s ended up in the ER after noticing dark brown urine and deep muscle weakness. His creatine kinase levels were off the charts. Doctors connected it to high-dose atorvastatin and drug interactions with an antibiotic. His kidneys recovered, but he needed IV fluids for days. What can you do to stay safe? Watch for signs like extreme muscle pain, especially with cola-colored urine or sudden fatigue. Let your doctor know about any other medications or supplements you take, and ask about switching to a lower dose or hydrophilic statin, which may carry less risk. But just knowing this isn't enough, because what comes next doesn't affect your muscles or your organs. It drains your energy from the inside out. Number 4, fatigue. This isn't the kind of tired a nap can fix. It's the kind of exhaustion that wraps around you like a heavy coat and refuses to let go. You wake up tired. You move slow. Your body feels drained even after a full night of sleep. Fatigue is one of the most overlooked yet life-altering side effects of atorvastatin. The science behind it is clear. Atorvastatin reduces levels of coenzyme Q10, a nutrient your body needs to produce cellular energy. Without enough of it, your muscles weaken and your cells start working slower. This isn't laziness or age. It's real biochemical fatigue. In one real case, a retired nurse said she had to stop volunteering because she felt like her body was made of sandbags. Walking became a chore. She thought she was just aging until her doctor reviewed her medications and made a change. Her energy slowly returned. So what can help? Ask your provider about coenzyme Q10 supplements. Review your current dose and timing. Track your energy daily and write it down. Your fatigue might not be just life catching up, it could be the medication. But just knowing this isn't enough, because what follows doesn't just affect your body, it begins to cloud your mind. Number 5, memory loss and confusion. What if one tiny pill could make you forget where you parked your car or why you walked into the kitchen? That mental fog you brush off as stress or aging might actually be something else. Memory loss and confusion are now recognized side effects of atorvastatin. Though not everyone experiences them, the FDA has issued warnings after reports of short-term memory lapses and episodes of confusion. Atorvastatin is lipophilic, meaning it can cross the blood-brain barrier and interfere with cholesterol synthesis in the brain. And that matters because cholesterol is vital for neurotransmitters that control memory and mood. A retired pilot shared how he suddenly struggled to recall routine tasks he had done for decades. His wife noticed he was repeating questions and getting lost mid-sentence. After switching medications, the fog lifted within weeks. So what can you do if you or your loved ones notice sudden forgetfulness, difficulty concentrating, or mental sluggishness? Talk to your doctor. Track these symptoms in a journal. Ask about trying a hydrophilic statin or reducing your dosage. Your mind deserves clarity, but just knowing this isn't enough, because the next danger might quietly raise your blood sugar and push you into a lifelong diagnosis. Number 6, type 2 diabetes risk. Imagine taking a drug to protect your heart only to discover it's slowly pushing you toward diabetes. That's the hidden irony of atorvastatin. While it lowers cholesterol, it can also raise your blood sugar in ways that many people never expect. Studies have shown a 9% increased risk of developing type 2 diabetes in statin users, especially those already near the edge. Atorvastatin can reduce insulin sensitivity and interfere with how glucose moves into your cells. It also affects how much insulin your pancreas can release. Over time, this creates a slow rise in blood sugar levels that often goes unnoticed until it's too late. A woman in her early 60s shared how she started feeling thirstier and more tired after a year on statins. Routine labs showed her fasting glucose had crept into diabetic range. Her doctor adjusted her medication and added lifestyle changes. She caught it early. So what should you do if you are pre-diabetic or have a family history of diabetes? Ask your doctor to monitor your A1C regularly. Focus on a low glycemic diet and stay active. Consider lower doses or alternative statins. But just knowing this isn't enough, because the next symptom can pound inside your head and ruin your daily life without warning. Number 7, headaches. When your head starts pounding day after day, it's easy to blame stress or poor sleep. But what if that relentless pain is actually a sign your body's reacting badly to your medication? Persistent headaches are a lesser-known but very real side effect of atorvastatin. Some patients report dull aches, while others describe sharp throbbing pressure that won't go away. The cause: atorvastatin can alter blood vessel tone and disrupt neurotransmitter balance as your body adjusts to changes in cholesterol levels. These shifts can trigger headaches that feel completely different from your usual tension pain. One man shared how he started waking up with intense pressure behind his eyes just 2 weeks after starting statins. Over-the-counter painkillers barely helped. When his doctor switched him to a different medication, the headaches vanished within days. So what can you do track when your headaches began? Talk to your provider about adjusting the dose or taking the medication at night. Stay hydrated and avoid other headache triggers like alcohol or processed foods. But just knowing this isn't enough because the next symptom strikes where you least expect it, deep inside your digestive system. Number 8, gastrointestinal issues. You might expect a heart medication to affect your chest, not your stomach. But many people taking atorvastatin report sudden changes in digestion that seem to come out of nowhere. Atorvastatin can disrupt your gut in surprising ways. From nausea to diarrhea to bloating and cramping, these symptoms often start quietly and build over time. Why cholesterol is not just in your blood, it's also essential for the lining of your digestive tract. When levels drop too low, it can affect gut motility, nutrient absorption, and even the balance of your gut microbiome. One woman shared how her morning routine changed drastically after a few months on atorvastatin. Food she had eaten for years suddenly caused discomfort. She cut out coffee and dairy, but the symptoms stayed. When her doctor reduced the dose and added a probiotic, her digestion slowly normalized. What can you do? Take atorvastatin with food to reduce irritation. Add fiber-rich foods and stay hydrated. Track any new digestive issues and bring them to your doctor's attention. But just knowing this isn't enough because the next side effect doesn't just hit your body, it robs you of your rest night after night. Number 9, sleep disturbances. When you lose sleep night after night, everything else starts to fall apart. You feel irritable, you lose focus, and eventually your health begins to break down in ways that are hard to explain. Your atorvastatin has been linked to a wide range of sleep issues. People report insomnia, frequent night waking, and even vivid or disturbing dreams. While the exact reason is still being studied, researchers believe that atorvastatin may interfere with melatonin production and brain cholesterol pathways that regulate sleep and mood. The result is a restless mind and a body that never fully recovers. One man said he started waking up every night at 2 a.m., feeling wired and anxious. He tried meditation and changing his bedtime routine, but nothing worked. When his doctor shifted him to a different statin, his sleep gradually returned. What can help? Try taking your medication in the evening instead of the morning. Keep a sleep diary and discuss any changes with your healthcare provider. Avoid caffeine late in the day and create a calm bedtime routine. But just knowing this isn't enough because the next symptom might make every step you take feel like a risk you can't afford. Number 10, dizziness and balance problems. Have you ever felt like the ground beneath you suddenly shifted for no reason? That unsteady feeling might not be clumsiness or aging. It could be your body reacting to atorvastatin. Dizziness and balance issues are lesser known but alarming side effects of atorvastatin. This drug may interfere with nerve signaling and cholesterol levels in the brain, which are critical for maintaining your vestibular system, the part responsible for balance and spatial awareness. As a result, you may feel lightheaded, off balance, or even experience mild spinning sensations. A 67-year-old man shared how he stopped going on his morning walks after 2 near falls on flat ground. He assumed it was just part of getting older. But after reviewing his medications, his doctor confirmed the dizziness began shortly after starting atorvastatin. So what can help? Always rise slowly from sitting or lying positions. Report new dizziness right away. Ask your doctor to evaluate whether the dosage or medication type is right for you. Do not drive or climb stairs alone until the cause is identified. But just knowing this isn't enough because the next symptom might show up right on your skin and it's harder to ignore. Number 11, skin reactions and rashes. When your skin suddenly itches or breaks out in a rash, your first thought probably isn't your cholesterol medication. But for some people, that's exactly where the problem starts. Atorvastatin has been linked to unexpected skin reactions. These may appear as redness, dry patches, itching, or even hives. While some rashes are mild, others become inflamed and uncomfortable. What's happening under the surface? The drug can disrupt the skin's lipid layer and immune response, triggering inflammation in sensitive individuals. A 64-year-old woman developed an itchy red rash on her neck and arms weeks after starting atorvastatin. At first, she thought it was laundry detergent or stress, but after switching to a different statin, the rash disappeared completely. Her story is more common than most realize. So what can you do? Document when the rash started and whether it spreads or fades. Use gentle skincare products and avoid heavy perfumes. Show any skin changes to your doctor, especially if they persist or worsen. But just knowing this isn't enough because the next symptom doesn't just affect how you look or feel, it can slowly numb your hands and feet without warning. Number 13, erectile dysfunction and low libido. What if the medication protecting your heart was quietly stealing your confidence behind closed doors? Many men taking atorvastatin never expect it to affect their intimate life until it does. Erectile dysfunction and reduced libido have been reported in men using atorvastatin. Though not everyone experiences it, research shows that statins may reduce levels of testosterone and impact blood flow to reproductive organs. Since sexual function depends on both hormones and circulation, even subtle disruptions can lead to frustration and self-doubt. One man in his late 60s said he started avoiding intimacy without realizing why. He chalked it up to age or stress. But after switching to a different medication under his doctor's guidance, his energy and connection with his partner began to return. What can you do? If you notice changes in desire or performance, do not stay silent. Talk to your healthcare provider. Ask about hormone testing and whether a lower dose or alternative statin is a better fit for you. But just knowing this isn't enough because the next side effect doesn't stop with your body, it begins to reshape your entire emotional world. Number 14, mood changes and depression. Have you ever felt emotionally flat or disconnected without knowing why? If you are taking atorvastatin and suddenly notice your mood shifting, it may not be just life stress. It might be chemical. Atorvastatin has been associated with mood swings, emotional numbness, and even symptoms of depression. Scientists believe the medication may interfere with the production of serotonin and dopamine, two brain chemicals that regulate mood and motivation. Since statins can cross the blood-brain barrier, they may affect the very systems that help you feel joy and emotional balance. One woman said she no longer felt excited about anything, not birthdays, not vacations, not even family gatherings. Her doctor recognized the change as a possible side effect and adjusted her prescription. Within weeks, her sense of self returned. What can you do? Keep track of changes in your mood, motivation, or energy. Share these shifts with your doctor honestly. Ask about mental health support or whether another statin may offer the same heart benefits without the emotional toll. But just knowing this isn't enough because the next symptom strikes at the core of how you move, and it could rob you of your independence before you realize it. Number 15, joint pain and stiffness. What if the pill meant to keep your heart strong was the reason your knees now struggle to bend? For many taking atorvastatin, joint pain is more than a nuisance. It's a daily battle. Atorvastatin has been linked to increased joint pain and stiffness, especially in the knees, hips, wrists, and shoulders. This happens because statins may affect cartilage structure and reduce levels of cholesterol-dependent compounds in the synovial fluid, the natural lubricant your joints rely on. The result, grinding, discomfort, and loss of mobility. A 70-year-old former runner said his morning walks turned into painful limps. He assumed it was arthritis, but after reviewing his medications, his doctor lowered the statin dose and added anti-inflammatory support. The pain eased. He got back to moving again slowly but with hope. So what can you do? Never ignore new or worsening joint pain. Ask about physical therapy support or joint-friendly supplements like glucosamine. A lower statin dose or a switch to another type may also help preserve your mobility. But just knowing this isn't enough because the real solution comes from seeing the full picture. And now that you've seen all 15 side effects, what you do next could change everything. Now that you've seen the 15 most dangerous side effects of atorvastatin, backed by science and real stories, the next step is in your hands. Maybe you recognized one of these symptoms in yourself or someone you love. Maybe you've been feeling tired for no reason or struggling with memory fog or joint pain that won't go away. The good news is this awareness is the first step toward healing. This video is not meant to scare you. It's meant to empower you, to show you that you are not alone, that your symptoms matter, and that the choices you make starting today could change the direction of your health. The truth is, many of these side effects can be reversed. With proper monitoring, with the right questions, with a conversation that starts with the words, "Can we review my medication?" If you are taking a torvastatin and experiencing any of these effects, talk to your doctor. Ask for alternatives. Ask about dosage changes. Ask about supplements that support your body while protecting your heart. There is always a safer path forward, and you deserve to find it. If this video helped you learn something new, please do two things. First, save this video so you can come back to it anytime. Second, subscribe to this channel for weekly tips on senior health medications and food-based solutions that are easy, safe, and backed by research. You are stronger than you think. You are wiser than you've been told. And you have the power to protect your future one informed choice at a time. Our next video will dive into the 7 worst vitamin mistakes seniors over 60 make and how to fix them, starting with your next pill. You do not want to miss it. Like this video if you found value. Share it with someone you care about. And subscribe so we can keep helping each other feel better, move better, and live longer together.